I wanted to start at one of my favorite places and perhaps one of yours as well. This iconic image of Thomas Sayre's gyre is the focus of the North Carolina Museum of Art's rebranding. This earth casting is emblematic of the intersection of humanity and nature. Gyre uplifts the spirit and is a crossroads for social interaction. It also allows for innumerable views. If we look a bit more closely, we get a different perspective. We see biped and quadruped trail users, and in the background, a remnant of the prior history of this place, including a smokestack from an earlier era, and in the foreground, a chair. Tom Shields from the Penland School of Craft and the other Blue Ridge knows about the need to maintain perspective. It's easy to miss the chairs and the trees, but focusing only on the chairs misses the bigger picture. Creating a true district in the Blue Ridge corridor requires attention to detail, but also a broader vision. Movement towards a sustainable, healthy, and equitable community in West Raleigh has often involved untangling dense thickets. Siloed state agencies, multi-level governmental jurisdiction, and master plans disregarding area context are some of the obstacles that can cause a loss of focus. But an African-American civil rights song based on the gospel tune, "Keep Your Hand on the Plow," provides the answer. Keep your eyes on the prize. So let's go back to the origin story. While the area's history goes back to the Native Americans, the short-lived Confederate Camp Mangum, and the existence of tenant farms, the modern era starts in 1918. During that year, the federal government leased land holdings stretching from then North Carolina State College to today's RDU Airport for use as a World War I tank training camp. After the war's end later that year, the state purchased the land for future use. While this area remained mostly undeveloped until the 1980s, there was one site that brought in folks from around the state. Unfortunately, some came for other reasons. For generations, North Carolina's economic base had rested on three pillars: tobacco, textiles, and furniture. However, these predominantly low-wage industries resulted in the state experiencing a significant brain drain after World War II. In response, a visionary group of leaders from both the public and private sectors leveraged the intellectual assets of three universities surrounding a parcel of land to create Research Triangle Park in 1959. As this 1967 document from the State Fair demonstrates, RTP transformed the regional growth trajectory. Raleigh's borders rapidly expanded in the 1970s through the 1990s. During this time, the state divested and repurposed some of their properties in West Raleigh. After the opening of the new arena in 1999, an Indie Week article noted that, quote, "The idea that some residents seem to have that West Raleigh can remain in its current pastoral state, except for a big arena and a few hotels, seems at best unlikely," close quote. Civic leaders saw the possibility of a distinct destination catalyzed by a vibrant, dynamic sports and entertainment complex with office and residential development. However, the infrastructure did not keep up with institutional growth in the area. There was a well-deserved perception that development in the area was occurring without comprehensive guidance. As one then community activist pictured here in a 2007 Indie Week article noted, "It's a mishmash out here now, but there's still a ton of land. The question is, how are you going to connect the dots?" Raleigh developed a reputation as sprawly. In response, the city created a comprehensive plan promoting 8 growth centers and 12 multimodal corridors. Blue Ridge Road was to be considered a multimodal corridor with West Raleigh as a growth center. By 2008, there was some convergence about the need to address growth in this area. An initial meeting between the executive teams at Rex and the Museum of Art led to broader conversations between area stakeholders. The component parts to attract a diverse population were noted to be in place: the Medical Museum and University Zones, Greenway and Open Space, East-West Recreational Corridor. The Blue Ridge Corridor Stakeholders Advisory Group started meeting bi-monthly and adopted a vision for the area. A carefully zoned district would encourage mixed-use public and private development, including cultural, commercial, entertainment, residential, and office usage. The Blue Ridge Corridor became the focus of a master's level studio class at North Carolina State College of Design in 2010. One of the graduate students noted that the overall location chosen by her advisor, Dr. Kofi Boone, was representative of what they were seeing studying in the studio: inner ring suburbs, areas of transition for Raleigh's future where population growth was expected to significantly increase by 2030. She added that the conceptual plans incorporated, quote, "good environmental health, physical health, and social health through the introduced ecological systems, transit systems, and mixed-use high-density development. It's a redesigned public space that allows for easy access to recreation, shopping, work, and healthcare." At the same time, the General Assembly became interested in sustainable growth in the face of rapid development, particularly within urban areas and specifically in the Piedmont. The North Carolina Sustainable Communities Task Force adapted the 6 sustainability principles from the Partnership for Sustainable Communities, a federal program that was a collaboration between HUD, EPA, and DOT. The North Carolina Task Force issued a challenge grant to promote planning for sustainability. The Blue Ridge Corridor Stakeholders Group proposal scored number 1 statewide and kickstarted planning efforts in the corridor. Meetings were held to incorporate views from both the C-suite level and on the ground. In the short term, the 2012 Blue Ridge Road District Study focused on land use planning, transportation, housing, public and private open space, public health, and economic development in order to establish a range of next steps and actions. These were to be informed by agreement among stakeholders, amendments to master plans already in place, and formulation of action plans for a range of priority projects. The Blue Ridge Road District Study encompassed 3 major framework elements. The first was transportation. The transportation plan envisioned a change from a largely auto-dependent to a multimodal corridor with a unique character. These improvements would reconfigure street connections to Blue Ridge in order to accommodate an interconnected and pedestrian-friendly district as redevelopment occurred. The second major framework element was green infrastructure, particularly important in a district with much undeveloped forest and pasture. The plan recommended conservation of existing public open space and creation of new passive and active open space amenities throughout the district. A strengthened and enhanced district-wide pedestrian and bike system would serve to link these open space amenities. Once resident density and population numbers were significant, additional park facilities would be provided, complemented by small-scale green spaces associated with private commercial and residential development as the district grew. In order to achieve the vision that this plan captured, densification of development would have to occur over time. Additionally, it was clear that the area would greatly benefit from a more diverse range of uses. Restaurants, service retail, and residential were either non-existent or underrepresented. The plan recognized that the market would support these uses immediately if the character of the existing infrastructure were improved and properly entitled land was readily available. The plan recognized the existence of anchor institutions that would serve as the centers for driving redevelopment within 4 distinct but connected districts. The Health and Wellness District anchored by UNC Rex Healthcare and including support office, medical services, and some potential residential. The Arts and Research District anchored by the North Carolina Museum of Art, inclusive of mixed use along with potential development on museum property, complementing its current mission. The Entertainment and Education District to establish a vibrant mixed-use district with commercial uses that thrive on event traffic and visitors to the fairgrounds. And the South of Hillsborough District in view of the large potential for transit-oriented development with light rail and regional rail. This district would be primarily residential in nature with some small mixed-use development and key intersections. At least commuter rail is still on the horizon. The district plan predicted a 34% natural property value increase by 2030 with no additional intervention. This would rise to 110% through full implementation of the Blue Ridge Corridor plan. The Blue Ridge Corridor study led the city to expand the West Raleigh Growth Center, adding both the Health and Wellness and Arts and Research districts. The Blue Ridge Corridor Alliance, or BRCA, was incorporated as a 501c3 in 2014. With the cooperation and encouragement of North Carolina State University, the BRCA contracted staffing through the Hillsborough Street Community Services Corporation to leverage services and implement the recommendations of the district plan. At the same time, the impact of the original district study led to the involvement of additional stakeholders. It became clear that while the district plan had focused on the Blue Ridge Corridor itself, the West Raleigh Growth Center also needed to be considered as a larger ecosystem.
Located in West Raleigh, the Greater Blue Ridge Corridor is just a few minutes from downtown. It's situated amongst some of the city's best established neighborhoods and has a unique position that is near North Carolina State University, Meredith College, Umstead State Park, the Raleigh-Durham International Airport, and Research Triangle Park. Centered around a 3-mile stretch of Blue Ridge Road, the region is rapidly becoming a distinct destination to live, work, and play, in part because of its world-class community assets such as parks and greenways at Umstead State Park, the Prairie Ridge Eco Station, and the J.C. Ralston Arboretum, higher education and research facilities at NC State Centennial Biomedical Campus and College of Veterinary Medicine, UNC Rex Hospital, which services over 1 million patient visits every year, PNC Arena and Carter Finley Stadium, home to professional and collegiate sporting facility, North Carolina Museum of Art and Art Park, as well as the State Fairgrounds, which both host many concerts and performances, and a collection of residential and mixed-use communities. While these venues attract millions of visitors every year and are home to thousands of Raleigh residents, the region lacked a coherent sense of place, shared vision, and community identity. That's where the Blue Ridge Corridor Alliance came in. This group of stakeholders partnered with the City of Raleigh to commission the Blue Ridge Corridor Study, which created a vision, established design standards, and recommended 4 districts based around existing community assets: health and wellness, arts and research, entertainment and education, and south of Hillsborough, each with its own focus and identity. This has helped ignite significant growth in this region. Existing and proposed projects have built a development pipeline of over $500 million of investment that is to be completed in the near future. For the region to achieve its full potential, the stakeholders will need to continue to work together. The Blue Ridge Corridor Alliance is championing urban redevelopment to form a vibrant region that is focused on healthy living, research, education, arts, hospitality, and entertainment, all of which is connected within the greater fabric of the city of Raleigh.
Since 2014, the BRCA has functioned as a volunteer-driven organization with limited funding from institutional, business, and residential stakeholders in addition to the City of Raleigh. The BRCA has worked as a convening group for the complex array of public agencies, private interests, and concerned citizens, constituting a strategic 3-square-mile area within one of the nation's most dynamically growing regions. The Blue Ridge Corridor already serves as both the nexus of the Triangle and the gateway to Raleigh. The 2018 Destination Strategic Plan produced for the Greater Raleigh Convention and Visitors Bureau advised that both downtown and the Blue Ridge Corridor be considered development priorities by 2028 in view of the high opportunity for both community transformation and destination assets. From its origins, the BRCA has looked to punch above its weight, always eager to engage with other organizations interested in promoting best practices. Concurrent with the development of the Blue Ridge Road District Study, the stakeholders obtained funding from Blue Cross Blue Shield Foundation of North Carolina for the state's first Comprehensive Health Impact Assessment, or HIA. HIAs are designed to assess how a proposed decision will affect the health of a population. This HIA, which was coordinated through the UNC Gilding School of Public Health, provided evidence on how population health would likely be affected by adding sidewalks and bicycle paths. The HIA focused on multimodal redevelopment of the district with its focal point as the approximately 10,000 current residents living within a mile and a half of the Museum of Art. The simulation model predicted that the plan would increase average daily time spent walking for transportation by 17 minutes among 60% of residents over the 25-year period after the redesign was completed. The value of these health benefits was $21,000 per resident in 2012 dollars, or a total estimated $234 million. This data was incorporated into North Carolina Department of Transportation's pedestrian and bicycle plan. The HIA also had a broader impact. Several members of the HIA Advisory Board felt that this process demonstrated how Wake County could serve as a statewide, if not national, model for population health. Commissioner Sig Hutchinson worked with several other members of this team, including the county's public health director, to champion a wider effort in support of healthy communities, including addressing racial health disparities. This eventually led to the county's population health initiative, Live Well Wake. With the support of the City of Raleigh, the BRCA compiled an area profile chock full of statistics regarding the Greater Blue Ridge District's economic potency. But one of the most compelling numbers from this 2018 study was that of the 25,000 employed professionals in the district, only 289 lived in the area where they worked. The Greater Blue Ridge Corridor's growth potential has made it increasingly desirable for market rate development, but the rising property values have also made the prospects for affordable housing more difficult in the face of increased need. At the same time, the plethora of public lands that could be available for redevelopment also provide opportunities. In 2019, a graduate-level team of UNC Department of City and Regional Planning students evaluated areas in the corridor with the highest potential as affordable housing. The recommendations for preservation, acquisition, and adaptive reuse and development of affordable housing delineate the possibilities for this district to help address this critical issue. Most recently, the BRCA has partnered with the Umstead Coalition and Duke University's Nicholas School of the Environment on stormwater management. Rapid development has increased runoff in an environmentally sensitive area. As a result, graduate level students from Duke are planning to evaluate the current watershed conditions, as well as learn and engage in policy and regulatory options. The goal is to influence stormwater management considerations for current and future projects in view of anticipated development and redevelopment of public lands. Investment in the Blue Ridge Corridor District's transportation infrastructure reflects both the growth potential and its strategic location at the nexus of the triangle. The BRCA advocated for many of these projects in order to accommodate multimodal options for urban density. The question is not whether the Blue Ridge Corridor will grow, but how. In this context, two new major projects and a proposed upgrade have recently increased the visibility of this district. One of these projects is planned for a parcel designated by a yellow marker at the center of this map. This site is at ground zero for the Blue Ridge Health Impact Assessment and has the potential to model healthier lifestyles for staff and citizens of the state. The new North Carolina Department of Health and Human Services headquarters almost landed in Granville County. The pandemic played a significant role in keeping it closer to home, but the BRCA's longtime advocacy helped bring it to Blue Ridge Road. The BRCA has worked closely with the North Carolina Department of Administration in conceptualizing the future of this key opportunity site directly across from the North Carolina Museum of Art. Furthermore, phases 2 and 3 will complete the build-out of this 36-acre site and have the potential to serve as a prototype in North Carolina for public-private partnerships on state-owned land. Phase 3 will be mixed use and include amenities supporting the approximately 5,000 employees who will eventually work on the site. Upon completion, the total investment will be over $1 billion. Bandwidth, a telecommunications technology firm, will be moving its headquarters and some 1,000 employees from Centennial Campus to a new $70 million headquarters in Raleigh at the southwest corner of Reedy Creek and Edwards Mill Roads. A key design team member who had worked on the site for 2 years noted that, quote, part of what drew Bandwidth to this corridor in this area is all this interconnectedness that really plays into what Bandwidth is seeking in their new home. The 2012 district plan recommended a vibrant mixed-use entertainment and education district with commercial uses that thrive on event traffic. The new Centennial Authority leadership is fully supportive and leading with this concept. The built environment has changed over the past few decades and has now begun to catch up with the visionaries. As urbanist James Howard Kunstler pointed out, the 20th century was about getting around. The 21st century will be about staying in a place worth staying in. We are now at a crossroads for the future. Over the past 10 years, some projects have moved forward in the Blue Ridge Corridor District that are incompatible with this consensus vision. Creating a Blue Ridge Corridor Municipal Services District, or MSD, will help ensure that this area of West Raleigh achieves its maximum potential. The BRCA recently engaged the consulting firm Benchmark Planning to assess how an MSD could look on the ground. Their evaluation included MSDs, also termed business improvement districts, in other cities that can serve as paradigms for the Blue Ridge District. In North Carolina, University City Partners in Charlotte has leveraged the strength of its institutional stakeholders, including UNC Charlotte, hospital and offices, to create a thriving district that incorporates retail, housing, and transit. Breaking down the traditional silos of housing, transportation, and environmental policy is essential in order to consider these issues as they exist in the real world, inextricably connected. The Blue Ridge Corridor Alliance has demonstrated its commitment to creating an equitable, healthy, and sustainable community, including recognizing and supporting existing communities and neighborhoods. As the Native American proverb says, we do not inherit this land from our ancestors, we borrow it from our children. Please do not lose this window of opportunity. Thank you.